Knock, knock, knock. Hi, my name is Rachel and I'm your nurse today. I'm going to start with some hand hygiene here. I'm washing my hands per CDC guidelines, at least 20 seconds. How are you doing today? Good. Can I take a look at your wrist here? Get your name and date of birth. Okay, I'm looking at their armband. Morgan Smith, 2/27/1990. Great. And do you have any allergies? Any at all? None? Okay. And I'm ensuring my patient's privacy here, and I am going to make sure that the surrounding and the environment around my patient is safe. Okay, and it is. And I am going to make sure that the bed is the right height, and it is as for proper body mechanics. And the devices along the back here, the equipment, the suctioning equipment, the oxygen, everything is within working order, and it is. And I'm going to be telling my patient that I want to verify the doctor's orders, and I'm going to go and get my supplies. And I have my supplies here, and I have everything I need, and I have verified the doctor's orders. And it's for this NG tube is for gastric decompression, and I have verified the tubing and the tip and the gauge. All right, and I'm going to do some patient education for my patient and talk to them about the procedure. So we're going to be inserting a nasogastric tube, through your nose to your stomach, okay? And this is to relieve you of some gas and fluid that might be making you uncomfortable right now, okay? And do you have any questions about the procedure? Okay, they don't have any questions at this time. So I'm going to assess need of the nasogastric tube. And first I'm going to be taking a look at their abdomen here, and I see a little bit of distension, okay? I'm going to go ahead and auscultate though my bowel sounds, and I'm auscultating. And yep, Morgan, your bowel sounds are a little quieter than normal. And I'm going to palpate here, and I can feel the distension. And is there some tenderness? And yes, there is. So hopefully this NG tube will make you feel a little bit better, okay? And I'm going to be taking a look at their nares right here, checking for patency. Okay, clean and patents as from what I see, but I'm going to check. So go ahead and push on one nose, blow in and out. The other nose, blow in and out. Okay, so both nares are clean and patent, and I'm going to use the left nare for this procedure. And I can see that there's no deviation. There's no deviation here. And can you go ahead and swallow for me? And the patient swallows, and they are able to swallow. Okay, now we're going to go ahead and measure the tubing, okay? And just be assured that at any point during the procedure that you feel any severe discomfort or pain, or you feel like you can't breathe, please let me know. And let me know by raising your arm like this. So the patient demonstrates that they can raise their arm and if they feel distress, okay? So they acknowledge that. And I go ahead and I take my tubing here, and I'm going to measure from the tip of the nose here, okay? And I'm going to measure to the earlobe. And then I'm going to go down to the xiphoid process, right there. So I have my spot, and I'm going to mark that with some tape here. Okay. So I've marked it with tape, and I'm going to put it on my clean table for a second while I put my drape right here on my patient and secure it. Okay, and just a reminder, raise your arm if you feel any severe discomfort, okay? Go ahead and flex your neck backward, your head against the pillow. Patient is in high Fowler's position, Okay, and I am lubricating. I have lubricated my tip of my nasogastric tube 4 inches. And I am going to place this tube for the sake of this video right here on the side because I have no opening. So this is my left nostril right here that I'm using. So I'm going in a few inches and then the patient starts to gag. So I stop and I pull back a little bit and I give the patient a little sip of water with a straw, or I can ask them to dry swallow for the procedure, and I ask them to put their head forward, chin to chest. Okay, so we do that, and I'm advancing my tube. Okay, their chin to chest. If there's any respiratory distress at all, I pull this tube immediately out. Okay, advancing. Okay, and I've reached my mark. So I'm gonna hold that in place and I'm gonna secure it with tape. And I'm going to use a chevron method because tape is, this kind of tape is all that I have. And the chevron hopefully will help it stay in place. Okay, now I'm going to check placement of my NG tube. And I'm going to do that with my piston syringe right here. And I'm going to take this little piece off, and I'm not going to lose it because it's very important. I need it for suctioning. And I'm going to place it here for a minute. And I'm going to aspirate just a little bit of the stomach contents. Okay. And I'm going to use a clamp if needed, if I can or should. And I'm going to go ahead and take some of the stomach contents and I'm going to put them on my litmus paper here. And the pH of these stomach contents is under 5.5, which is good. That's what we want. And but best practice is to get an x-ray to ensure placement. And so for this video, we have got an x-ray and it is in place. And so we're going to be able to continue here. And we're going to go ahead and connect this tubing to the suctioning equipment in the back here. And I'm going to hook it up. And I'm going to put it on low suctioning per doctor's orders. Okay. And now that I've done that, I'm going to take my supplies and I'm going to clean up here. And I'm going to get rid of all my equipment. I'm going to get rid of it. I'm going to make sure that my patient is safe. The bed is low and blocked. The rails are up. They don't need anything. Their call light is within reach. They're comfortable. And I'm going to thank them. And I'm going to wash my hands per CDC guidelines, 20 seconds here, and leave the room.